All righty, everyone. Welcome to another session of The Doctors Are In. We look forward to being able to serve you to the best of our ability. Remember, as we in the beginning, when you entered into this wonderful sanctuary with us, that we are not diagnosing, treating, curing anything. We are just simply having a wonderful conversation so that you can be aware of different educational resources that are out there, different things to consider as you embark on the continuation of your personal health and healing journey. This is brought to you by It Takes a Village Ministry, and we do this in collaboration with Health Revival Partners and Sankofa Healing Enrichment. I have with us today the wonderful, the magnificent Dr. Thomas Lewis. Yay!
Health Revival Partners never
No,
cooperate.
Dr. Lewis.
You said in cooperation with Health Revival Partners. We don't cooperate.
You don't cooperate, not at all. No,
Not
y'all are just
really.
some ornery old guys. That's
Yeah.
in any case.
Yep.
We
I'm
have a
becoming.
couple of questions,
Let's do it.
and we always start with the questions that are from the people that are here live with us in person. And then we're going to move on to the questions that were sent in via email. All righty. So our first question that I see here is consider a situation where an adult individual has chronic Epstein-Barr infection, and that person is also anemic. Strategy for that person to take some form of iron to correct the anemia without the iron stimulating the replication of the Epstein-Barr virus. All righty, I'm going to throw that to you first, Dr. Lewis.
Oh, what was the question? Just kidding. Um, you know, First of all, everybody has Epstein-Barr, and it always becomes a question of whether it's reactive or not. And that's where the white blood cells come in. But I think you can treat Epstein-Barr with some simple things. I think it'd be very clear that Epstein-Barr has been in a turbo mode, if we use the same um, adjective is used in turbo cancer since SARS-CoV-2, and I've done a lot of testing with the spike antibody, and everybody has some, and people are getting more from shedding. There's no question about it. I've documented that well. So that makes Epstein-Barr come alive, and what we're doing with Epstein-Barr generally is a baseline of ivermectin hydroxychloroquine, a baseline of that, twice a day ivermectin, twice a day hydroxychloroquine. The hydroxychloroquine, they're both scripts. It's 200 200 milligrams, yeah, twice a day. And then the ivermectin is kind of tied to weight. So a rule of thumb is if you're around 150, you're taking 12 milligrams twice a day. And then you do the Brownstein protocol, which is 4 days a month of high dose vitamin A, C, D, iodine with some selenium. And then you do our immunoglobulin omega IgG 2000. And that's worked very well. But I would suggest if you look at my blog on Health Revival Partners, I published something from an Iranian study that Dr. McCullough made available to me that high dose spirulina is having an impact on in hospitalization death. So it's a really good detoxing agent. And high dose means sort of like 2 tablespoons a few times a day for a while. And that was just a 7-day study. It worked very well. So, but did I hear something about gut? We've always got to straighten out gut. And I defer to Dr. Gamble on that because I learned recently, and I thought I had this breakthrough that no one understood, that rectal probiotics are the way to go. And then she just chided me and said, numbskull, we've been doing that for 20, 30, 40 years. And so it's really, I've got a case study now where it's the strongest case study ever. And now I'm having both my daughters go on probiotic suppositories and then rectal enemas. I don't want to get way into that, but if you want to, your gut is an open pipe. It's literally outside of your body, if you want to look at it that way. And to get things in the colon where it really matters, you have to go through the very strong acid in the gut. So why don't we go on rectally more often? And I think that's a underappreciated way to deliver. And it's a $1 trillion industry. And a lot of it is ineffectual if it's taken orally. But anyway, that's the Epstein-Barr. But the gut's the most important thing. When you're anemic, I don't give a darn about iron. It's a gut absorption related issue, and we have to fix the integrity of the gut. I've seen it over and over again, and there's even in the literature, believe it or not, scarce, but showing the relationship between gut function and absorption of specific minerals. And iron was one of the ones that I highlighted in my book, Health, Freedom, Loss. So, don't take iron. It's nauseating and it's not what you need. We need to fix the gut, fix absorption. Take a fulvic humic mineral for a while. That's the way it goes. And chew on a rusty nail. Okay, I didn't really say that. But
Well, another thing to consider with the iron is looking at your food sources. So a really good herb that can be used for iron is yellow dock. Another good thing for iron is blackstrap molasses. Now, not the yucky molasses that they have in the store that they just kind of like colorize something, but the actual blackstrap molasses, it can be a little bit difficult to get. And to look at improving the digestive system in terms of the stomach, in terms of improving the hydrochloric acid production in the stomach so that you
right.
have better absorption of the iron. And then, as Dr. Lewis was saying, vitamin C also helps with the absorption of iron. And then looking at regulating the way in which our stress is being dealt with. Because when you are stressed, you're going to compromise your entire digestive system, and you're going to compromise your body's ability to absorb your nutrients more effectively. So and also you have Swedish bitters, which would be good in terms of helping to improve the production of the hydrochloric acid, which would not only cut down on the viral load, but also improve the uptick of your iron into the body. So I want to throw it to Dr. Pero. We had the question about Epstein-Barr syndrome and not wanting to overactivate the viral load with iron, but the person has anemia. So they wanted to know what are some things to consider.
Right. And it's an iron deficiency anemia, I understood, correct? Okay. Yes, I heard some of what Dr. Lewis said. Thank you. And many of us, we've all been exposed to Epstein-Barr virus, right? It's a very common, ubiquitous virus in childhood. By childhood, most people have it, but then some of us go on that we can't clear it. So some of the tools I have is, number one, I agree. If the gut's not working, nothing's going to work. So you have to improve absorption. And in addition to detoxification, one of the things I do is, now I'm a homeopath, so I use homeopathics, but I just won't get into that now. But my favorite homeopathic tool, for those of you who are interested, is something called German biologic medicine, also known as homotoxicology, or it's also known as bioregulatory medicine. And if you want to know those protocols, I can share them. But anyway, so I use these remedies to kind of re-regulate the gut and clear the extracellular matrix and get cells communicating a bit better. I do massive dietary changes with the hope of improving the microbiome, because those microbes produce their metabolites. They're called metabolic response modifiers, but they're the products made by microbes literally tell the rest of the body what to do in terms of immune function. So you want to rebuild the microbes, especially those that focus on clearing viruses. So you have to rebuild a robust microbiome. The last thing I do is go after the Epstein-Barr virus. I don't go after a killing until we've got the leaky gut resolved. We're building on the microbiome, hopefully through fermented diet, but I think most people need probiotic supplements, even though ferments. And of course, I agree. We're talking about the tush. Please you can do fecal transplants if you have a healthy donor. Who's a healthy donor? A kid under the age of 2 who's not been vaccinated. That's a healthy donor and who has not gotten the COVID vaccine. Now, if you can find a kid like that, let me know who they are. But that's who you're looking for. So you regulate the microbiome, and then I put the nutrients back through diet preferably. I prefer plant-based iron like Floridex from Germany. if I'm going to do iron. And I agree with Dr. Michelle is using a vitamin C to improve absorption of iron. But again, if the gut's not working, you're right, Dr. Lewis, we're just wasting our money. You're going to poop it all out, or you're going to pee it out. If it's water soluble vitamins, when your urine turns that weird vitamin color, you're just peeing out your money there.
Yep.
So I work on that, and then I go after the Epstein-Barr virus. The tool I use, and I'm going to be talking about it. This is good timing on when am I talking about it? I think it's May 9th or no, May 30th. Actually, May 30th, I'm talking about Epstein-Barr virus using this series kits by Desbio. There are homeopathic series kits, and those are my go-to for treating infections. So if you're not familiar with them, you want to find a practitioner who does use Desbio series kits. They're called series symptoms relief kits because in homeopathy, we don't cure any disease, right? We got to be very mindful of our language. Otherwise, the FDA will do that to us. So we assist optimization of your health using these series kits. And I've had terrific results. Come on the 30th and I'll explain how to use it because it takes some practice as a practitioner and patient. So that's a long, quick answer. Is that okay?
No, but that was a brilliant answer.
Now, one second, Dr. Lewis. Dr. Huante, welcome from Mexico.
Hello, thank
Can
you.
you add to the mosaic here? What would you like to share with regards to either Epstein?
Yeah, well, actually, Dr. Michelle told everything. Diet is the first thing, our gut, repair our gut. And of course, I would only work with homeopathy, also to help with the gut and with the iron issue. So I don't have anything else to add about it.
So we're going to put you first up for the next one. So the next question we have is pertaining to general achiness and stiffness. It's a young woman who is 61 years old, and she wants to know what are some things that she should be considering. And we're going to start with Dr. Huante.
Well, we have to check why is that achiness from, if it's like from arthritis or what. So in homeopathy, we have to check every symptom, and according to that, you give a specific remedy to help out with the symptoms. So I think achiness is like a very, very wide area. So she would have to narrow her symptom. So I could help her.
All right. Dr. Pero. You're muted.
Oh, sorry. Overall achiness.
And stiffness.
And stiff?
Yeah.
So I agree also with Dr. Huante. Achiness is a vague symptom, and it could be the end of many metabolic or other biologic pathways, meaning it can be the result of neurologic issues, metabolic issues, infectious issues, dietary issues, sleep issues. So, so this overall malaise feeling. So it requires, it's very vague. However, or it could be mitochondrial for that matter. It can be just about anything that causes this overall sense of achiness. But I would first start to look, if someone is achy, I would look at their hydration status, lymphatic status. I would look at muscular function. I would look at their protein intake. And I probably would look at I also often get a gut feeling. I would probably look at environmental toxicants if somebody's achy and see what they're being exposed to, whether it's EMFs, pesticides, plastics, and see why they're not detoxing well and look at their detoxification pathways. When I hear stiffness, I start to think about hydration. Most Americans in general here do not drink enough water, at least half your body weight in water. And water is a big conversation. Most people are dehydrated right off the bat. So we've got to talk about hydration for if you're stiff. But if you're also stiff, you may not have enough collagen, or you're eating too much glyphosate, Roundup-based herbicides, because that glyphosate can swap with your glycine, which is in your collagen. So collagen is 90% glycine. And people like Dr. Seneff think it's swap. I think that's true because glycine is like glyphosate, the main ingredient Roundup, is like a synthetic amino acid. So you want to investigate, make sure there's no Roundup. I have a organic family, super organic. The kids came back high in glyphosate. I said, how is this possible? Water, air, you can check it. You can check it. So I look at that. And if people aren't eating bone broth or they're vegan, I do a lot of support with collagen. I'm a big fan of collagen. Maybe they need type 2 collagen. There are 4 types of collagen, my types 1 and 3, but I would look at type 2 collagen. If they're vegetarian or vegan, I would do a plant-based collagen, but I do bovine collagens for people who are meat eaters from grass-fed, grass-finished cows are my source. So kind of the way how I might think about it.
Dr. Lewis?
Yeah, those were really good answers. I think sometimes stiffness and joint creaking and all that's due to like the gluten and dairy intolerance. So once again, look at the gut. It all stems back from that. But I think otherwise the answers were really spot on. You know, I mean, I always look at pain as an energy crisis, okay? It's an energy crisis. You have a wound and there's all kinds of energy being expelled at that site to repair. When you have a headache, that's an energy crisis. And a lot of times things like this really famous doctor just sent me this thing on Toxoplasma gondii, crazy cat lady. And a lot of people have throbbing headaches and they're positive for Toxoplasma gondii because that's in your brain stealing energy from you. So your cells in an energy crisis. So we got to look at some off the wall things too, like these stealth infections that are electron stealers. Epstein-Barr is one of them, but oral pathogens can lead to pain in the jaw. But when it escapes and it gets into circulation, it can cause other things, not all that manifest in pain, but lead to degeneration and the need for more repair and recovery. And that's when you feel the pain. It's an energy crisis. So, you know, but you start at the basics. What are you eating and how you're digesting so you can you can at least be on the upside of managing that energy issue.
And I'd like to piggyback off after what Dr. Lewis and Dr. Pero said, that a lot of times that I've seen people exhibiting that symptom, it's dialing back to food sensitivity, sometimes even your nightshades, like your mushrooms, your tomatoes, and things of that nature will lead to that like general achiness, stiffness in the body. So I would definitely encourage someone to do a cleanse, a clean out, where you're eradicating, or should I say eliminating, some of your common triggers like the gluten, the casein, and in this case, your nightshades and corn. You know, those are the more common food sensitivity triggers that would lead to that general kind of achiness, stiffness in the body. Something to consider. And also activating the lymphatic system, you know, with skin brushing and things of that nature to improve the detoxification pathways, open them up a little bit more, and make sure that you're pooping. We were talking about the microbiome before. Make sure that you're actually pooping effectively, making sure that you're hydrating properly so that you can clear this stuff out of the body and it's not backing up into the interstitial areas, you know, surrounding all of the cells and creating general inflammation. All right, so we have another question, very, very specific. Dialing into a Zoom, this person saw with a cardiologist talking about niacin, and the person wants to know what would the starting doses be for a 78-year-old with AFib and CHF. And the first thing I'm going to say is that we do not give any kind of specific treatments or anything of that nature. I encourage people to really dial back into and contact specific practitioners so that you can get specific things, because none of us can really give anything specific because everyone is different, you know, and especially when you're dealing with something like niacin, you really want to be working with a practitioner, because niacin, when you start megadosing, can have significant impact on the body and can start to really create shifts that may or may not be what you're looking for. But that's my take. I'll throw this to the rest of the group.
I'll go
Who
last.
wants? Okay, Dr. Pero?
I agree. Niacin is a major B vitamin in the brain. And of course, you have to dose it right because you'll get flushing, niacin flush. But it's a super healthy vitamin, all the B vitamins. I agree. It's very individual. I agree with Dr. Michelle, very individually pulsed. So you want to do that in conjunction with somebody. So even though we pee out the B vitamins, they're water soluble. You can have those shifts that I agree. So I would work with someone regarding dosing. But if you do dose as a guideline, you want to start as low as an adult at 50 milligrams, not higher than that, maybe even 25 a day.
I'm
Otherwise,
with you on the 25. Yep.
you can get a
Completely.
significant niacin flush, which is not harmful, it's just uncomfortable. And you do accommodate into niacin as you've been on it for a while. You get, and you don't get the flush when you can go up in higher doses. And for those of you who also have high cholesterol, it is an anti a cholesterol lowering B vitamin. So that might be a benefit for some of you as well.
And that's one of the reasons why I really caution people with regards to niacin, to make sure that you're being monitored, especially with regards to your lipid panels, because in my experience, those things can dip significantly into the other range where it's too low. So you really want to make sure that that it's being monitored. If you start to get up to your mega dosing of say like 2,000-3,000 a day, yeah, just work with someone is what I'm saying. Dr. Lewis?
You know, when you have something like AFib, I had AFib in my 40s and I lived up in New England, I had Lyme disease. So like before we start worrying about things downstream from that, we want to deal with some of those major complaints you have, not from the symptomatic perspective, but from a root cause perspective. Because you know you seldom repair when you still have these disease processes matriculating in your body. That was my short answer to Dr. Michelle.
I'm like, wait a
I
minute.
know you were waiting for the crescendo. That was it.
Dr. Huante.
Yeah, I agree that the patient needs to go with a specific practitioner or a functional medicine doctor, so can have the adequate or the perfect dose, because yes, vitamins are specific for every person. It's not like everybody the same dose, so it has to be done specifically and be checked on.
Agreed.
Especially because this person is 78 years old. And I think as we get older, it's like babies. You know, I get really, really cautious with people who are older as well as people who are very young, because they tend to respond very significantly to things that other people can buffer, you know. And so I would tippy toe, but that's just me personally. All righty. So we had another question. Dr. Lewis recommended a dental 3D cone beam test. What is the benefit of getting this test?
Well, you know, the 3D cone beam, there are areas in your mouth, particularly if you have a root canal, but even crowns. I'll just give you an example. A 2D X-ray that the traditional dentist does is very low resolution. Even a 3D X-ray is not a highly precise instrument, and we're looking for subtleties. So one of my best testimonials in the oral health is a lady had slightly elevated white blood cells and a couple of things going on with high blood pressure and things like that. And I had to do a 3D cone beam, and the dentist found under a crown, okay, infection, and could tell it was impinging on her sinus. And her report back to me, and I saw the X-ray, and I have a expert on my team, Dr. Patty Berube, is a functional periodontist. And she said she had no pain in her sinus or her mouth, but it was so obvious it was there, but she had a lot of postnasal drips. So the mouth is the beginning of your digestive system, and the digestive system is the most important system in your body. So we can't overlook the mouth. And the dental community of today, they're doing root canals and they're taking root canals out. They're creating They're creating more harm than good. They're giving you fluoride, which is a proven neurotoxin, and it's in front of the CDC has been holding that information back forever. Watch Del Brigtree's show from like a year and a half ago. So, and mouthwashes, traditional mouthwashes they're recommending raise blood pressure. Nathan Bryant, the guru on nitric oxide, did a study of athletes and other people and showed that consistent use of these over-the-counter mouthwashes wipe out your microbiome and raise your blood pressure. So the mouth has to be looked at extremely, to the best extent that you can, because and no one, almost no one in the world uses blood tests to figure out what's going on in the mouth. Dr. Michelle and I are like two of the few in the world. But when your white blood cell, when your immune system's acting up a little bit, just a little bit, and you're getting older, it's almost always the mouth that's driving that process. So yeah, do your 3D Cambrian.
Dr. Petto?
I couldn't agree more with that. Whenever I am a mouth checker as well, and because every kid in the world has had their wisdom teeth out. And so these, when you have extractions, they create something potentially called cavitations. And those cavitations become little pockets of where microbes, pathologic microbes like to live. And each of those areas of your teeth where that you've had, let's say, a wisdom tooth extraction, or you have had a root canal, sit on a meridian that goes to a specific organ. And the best person I've ever read about that was Dr. Louisa Williams, who's a naturopath now in Texas. And so if you haven't read her book, Radical Medicine, I still refer to her book. I think it's about 10 years old, but it's beautiful. So you have the only way dentists can pick up, and you want a biologic dentist, can pick these up is with a 3D cone or a digital CAT scan. I just say, go get a digital CAT scan and just get a CAT scan of your oral cavity and see if you have, especially if you have root canals. I had a patient, I'll tell you a quick case. She's one of our employees, and she had early stages of inflammatory bowel disease. And when I took her case, she had a root canal right over the small bowel. We removed the front tooth and we put what we call flipper in. And that's a tooth that you take in and out. We did not put an implant, and her inflammatory bowel disease went away. It was remarkable. So dental health, and also what you have to know, because I am a pediatrician, is that the fetal microbiome and the placental microbiome looks just like mom's oral microbiome. And I'm talking about this tomorrow on The Real Truth About Health.
Absolutely.
So whatever is happening in mom's mouth is going to happen in the fetus's mouth and the placenta. So getting mom's oral cavity lined up, in the best without killing it with some yuggy mouthwash is really beneficial.
Awesome. Dr. Huante?
I have no idea what you're talking about.
No problem, no problem.
Not my field.
So Carla, do we have any questions from the chat?
Yes, we do. I have a question from Linda. It says, I've been diagnosed with nutcracker syndrome and a compressed iliac vein compressed by the iliac artery by 75%. The doctor is suggesting stenting the vein. The stent is titanium and nickel. She did skin testing and I did not react to the stent material. However, I do react to blood tests to nickel. The upside of doing this is that it could address many of my symptoms that have been plaguing me. However, I'm concerned about the nickel and metal in general in my body. She says she has never had anyone react to the vein stent. Would so appreciate your thoughts. Thank you, Linda.
All righty. Dr. Lewis or Dr. Petto?
I'm going to pass on that one.
Well, all of a sudden, I've started hearing about nutcracker syndrome in a couple of patients, which is shocking because before COVID, I never heard of nutcracker syndrome. And so she doesn't have any kind of clotting. She has a collapsed vein. I take it her iliac vein's collapsing.
Yes,
And they want to put in a nickel stent. Is that what I heard?
it's nickel and titanium.
I would avoid nickel at all costs. I would not put nickel in the body. Titanium, even though titanium, yes, if you need to put a stent in. Now, I am no expert on stenting. But I do know that nickel is highly inflammatory. So personally, I have a titanium screw in my knee. I had to get titanium. So yes, this does happen. But if you can avoid the nickel, I wouldn't use nickel, not me. Because then you get an autoimmune condition, then they can't find it, and you have to get it removed.
And-
So if they can just work with a titanium product, if this is something you must do, again, I don't know, then I would look for another less toxic metal.
The two things about it is there are no other stent materials except for the titanium nickel. And once they place it, it can't be removed. And so I am because it becomes part of the lining of your vein. And that's why I asked you about the nickel, because I am very concerned about nickel. But I wanted other people's opinions that are in the healthcare industry.
Is there a way to avoid the stenting?
Just live with the symptoms for the rest of my life.
Yep.
Well,
And
there's one more question there is, and I never heard of it before COVID, right? So the question is there endothelial vascular damage from spike protein? Spike protein affects vessels, right? So the question is whether you've been spiked, either through the vaccine, COVID, or both. And if you've been spiked in whatever format, you might have endothelial vasculature damage from that. And I wonder if you might, and if you want to look at your spike protein status, whether you could look at, if that might be your situation, whether you can do vascular repair. And that's something you might want to look at.
okay.
Carla, any other questions?
Yes, I have a question from Brenda. It says, is there anything you can do for varicose veins? I have them, and it looks like my son, age 22, and daughter, age 18, may be starting to have them.
All righty, who wants to go first? Dr.
You know,
Huante.
I wrote a patent on this, and I've never filed it, but when you look at there was a little French clinician, and a child was born with hideous port wine stains all over his face. And in 2 years, using beta blockers, they eliminated them. So those are sort of ectopic vessels as well. So I thought about doing transdermal natural beta blockers on those to see if we can help. But from an internal perspective, I'd love to see what the erythrocyte sedimentation rate is on the person and see if it has anything to do with the physiological imbalance in even the pH, the alkalinity of the blood. But things like, what the Japanese eat, this brown seaweed extract called fucoidan is supposed to have an astounding effect on the capillary bed, things like that. Those are some suggestions. There are products on the market for varicose veins, and I'm not really sure they support the science, but I think the beta blocker approach, and once again, there's a whole host of natural ones, may be the best way to go. But you never want to overdose on something that has a mechanism like that, because even though beta blockers are amazing drugs, sort of, in helping with various heart disease issues, they also have downsides. So they're not a wonder drug. So
Dr. Huante?
Well, obviously there's like this familiar predisposition. So in homeopathy, you can treat to diminish that predisposition, or if the daughter is already presenting symptoms, of course, she can have the remedy. So she has less varicose veins and with fewer symptoms like pain and rash and stuff like that. But also they could all use hamamelis in a topic way, whether it's a cream or a gel, and it could help on those veins. They're not going to disappear, but they're going to diminish the symptoms and the way they look.
Dr. Pero?
This is another thing that before COVID, I didn't see young people with varicosities. You just didn't see it. And now everyone's got varicosities. I see a lot of young people with varicosities. And I've heard, I just prescribed Hemamelis virginicus, what Dr. Huante's talking about, to somebody with hemorrhoids today for the vascular instability. So like the previous question, I would look for vascular damage from a spike protein, whatever format a person may have received it, whether the vaccine or the virus or both. And restabilize the vascular integrity, because having vasculitis or vascular inflammation at such a young age is unusual. We did not see that in children before COVID. It was unusual. And now I agree with Dr. Huante. There is some people have more vascular abnormalities, absolutely, in families. And in that case, I might do something like, once I ruled out spike proteinitis or spike proteinopathy, I might do something like Hemimellus virginicus 30C, use a lower potency because it's physical. And then Pacana, which is a German biologic medicine, has a homeopathic remedy called Habefac. And I would bring, and it deals with, I'm writing in the chat box, that remedy from Pacana, that's the name of the company, they're from Germany, it's German biologic medicine, can help family dispositions. This now, a classical homeopath, and I'm also classically trained, would say this person probably needs a constitutional remedy, but a lot of people cannot access constitutional remedies because of finding someone or the cost or whatever. So this is another way to do it. There are many ways to do it. So this is some other ideas.
Oh, awesome. Any other questions, Carla?
Yes, this question is from Tina Chang. I was exposed to mold for 4 years, did not have symptoms till the last year. What do you recommend?
This is one of Dr. Lewis's favorite.
No, it's actually Dr. Carter is Mr. Mold. I mean, cholestyramine has a lot of evidence behind it. Other than that, you got to detox. You know, you got to do a general detox of the gut with clay, with the spirulina, with IV vitamin C, maybe hyper. We had a nice talk on Wednesday evening about the super high atmospheric
Mm, sure.
oxygen, hyperbaric oxygen at 3 atmospheres, not 1.4, but 3. So these are the kinds of things that might knock that out. You know, mold's an interesting thing because mold's everywhere and we consume mold every day. Mold is the major component that breaks down your vegetables that, when they start rotting, but there's mold in everything. So, make sure that stomach acid is, I'll use my Boston accent, super, super, super strong. Okay. And that's your barrier. Your nasal, your lungs, your esophageal, but your gut. It's a huge place to have barrier immunity at its best.
When we talk about molds, I'm always curious about it in terms of the standpoint of whether or not it's because we've had a breakdown of the microbiome in most people. And the reason why I'm thinking that is because mold is not new, especially when we think about Europe, like, the dank chap places of England and things of that nature. They're consumed with mold. So why is it that now we see more of a quote unquote sensitivity or a reaction to mold? And what I'm thinking, and you guys can let me know if I'm in the wrong track, I'm thinking is because we've had a breakdown of the intestinal integrity in the majority of people. And so we become more sensitive to it because we don't have the good guys in there to bring balance. What are your thoughts?
I mean, we're just unhealthier than we ever were compared to other generations. I mean, I had a guy on my webinar series, I read his book, Paul Clayton. He wrote about the mid-Victorian diets, how the mid-Victorian lived, ate, and died, and they outlived Brits. It's misinformation about longevity. I mean, 0 to 6 in 1840 in the United States, 42% of children didn't make it to age 6. So if you bake them into a longevity projection, then it looks like we only lived to 45. The mid-Victorians lived longer once you made it past age 6 compared to Brits today who make it past age 6 than Brits today with all the super duper healthcare. They raised their own chickens. They had their own garden. They did physical labor. They were outside. So we're just much, much more vulnerable to these things that like Dr. Michelle, you pointed out to me, why are these things there? They're there the same reason they're in lettuce. So when we die, they break us down and decompose us. We're not supposed to go to the undertaker. But our immune system is like at half staff, and so we're half dead. Pretty gory, but that's the
And I
truth.
think because, well, also because we live in a bubble, I compare,
Yeah.
people who are in the city versus those of us in the country. And I'm completely surrounded by chicken poop and goat poop and all the other stuff that they keep on warning you about, but it's fine. The same thing with my dog. She's exposed to everything out there. She goes out and eats deer poop, you know, and she is like the most healthy dog I've ever seen. So I'm wondering if the other part of it is that we've become so encapsulated in these bubbles where we're not challenging the immune system. And so as soon as a little thing goes whispers on us, we get overreactive because we're not used to having that robust kind of immune response.
The number one disease that that confirms that, and I'm sure Dr. Perro is very familiar with that, is pandas. It's the hygiene hypothesis on steroids.
Any thoughts, Dr. Perro?
I'm sorry. I also think that also they have made us believe that we are weak, that we are weak humans, and that our immune system doesn't work. So it's like the industry and they want us to believe that we need their medicines, we need their vaccines, because we're so weak that any virus, any mold, any bacteria, anything that is flying around here is gonna make me sick. So we have to also turn around our beliefs and see that we're great, that God made us with a great body, with organs, with functions, with everything, and we can deal with all the stuff that is surrounding us. We're not weak, but they're selling us the story that we have to do or we have to buy and take some chemicals in order to survive in the world.
Dr. Perro?
I would add in, of course, getting back to the mold question, Dr. Michelle, I agree with you. I think that of all the people I see, mostly kids, 90% of them have intestinal permeability. And people did not have intestinal permeability before. And what we did that introduced was 1996 to 1998, we created GMOs and their associated pesticides. So our diets radically changed in 1996 to 1998. What also changed was the barrage of ultra-processed foods, which have wrecked our microbiome. So we're supposed to have fungi, a type of mold in our gut. We do. We have archaea, we have protozoa, we have bacteria, viruses, we have fungi. But we now, I believe, because of what you say, we have an imbalanced dysbiosis of a microbiome. And because we have this intestinal permeability and the microbes are no longer, we do have a biofilm that overlays our intestinal barrier, normal biofilm. Not all biofilms are bad. And they're made of microbes. And because of glyphosate, so ubiquitous, it's an antibiotic and everything else, not just, ultra-processed foods.
Chlorine in the water.
It kills the microbiome. Emulsifiers in foods kill the microbiome. So now we have intestinal permeability and everything is leaking across and causing systemic inflammation. But in that mold, for the mold individual, if you don't lower your exposure rate, you're not going to get better anyway. So it has to be a reduction in the allostatic load of whatever toxicants you're dealing with, whether it's mold, air pollution, pesticides, parabens, whatever, while you have to kind of reformulate those zoululin little warrior barriers in your intestinal lining. So you have to rebuild your intestinal lining, and there's so many ways to do it: homeopathically, herbally, nutraceutically, energetically, prayer. However you do it, there are multiple ways of rebuilding your gut. And I agree, if people keep telling us we're sick, we will be sick. That's the mindset. So what we have to do is reclaim our health and say our bodies have the inherent ability, once we remove the toxic aspects of it, to heal itself. But you need guidance, and that's why you're all here tonight. Thank you, Dr. Michelle, to help you guys do it, because it's not easy. If it was easy, everybody would have done it already. It's not easy. So we have to kind of find the way that best suits you. This is individualized. Not everyone responds the same way. So that's why it's best to work with a holistic practitioner of some kind, a naturopath, or a homeopath, or whatever, an osteopath, whatever you feel but is best suited for you as an individual.
And that leads me to remind everyone that you can always feel free to follow up with any of us that are here by going to the page, It Takes a Village Ministry, going to our Doctors RN page, and you'll see the contact information. I have to add Dr. Perro's information. If you need to get in touch with Dr. Perro, you can reach out to me and I'll definitely get you in touch with her. I see we have a question from Linda.
Actually, I'm just a layperson, but I want to add something about mold because I was deathly ill from mold for 4 years before I knew what was making me sick. And I started going insane. I thought I was going to end up in an insane asylum. And I wonder if people, especially in the past, that have we've considered gone crazy, right? If it's been a mold exposure.
Sometimes it was.
Yeah, I mean, that's just a thought that I
Sometimes.
had because the road I was going down.
Moldy.
I'm sorry.
Yeah, sometimes.
Yeah.
I
Anyway,
said, yeah, it has been shown that sometimes it was related. Yeah. Carla, any other questions?
Yes, we have a question from Jim. He asked, if you have a root canal, what do you do? I had my wisdom teeth cut out at 14 before getting braces. Thanks, Jim.
Thank
I
you.
can answer that one. Get your root canal removed if it's causing problems. If you just have one or two and it's not causing problems and you're healthy, your body might be able to manage it. Back in the day, I used to have parents and people take them out. But then over time, some of us can handle them, one or two perhaps. But if you find that you're sick and your health is being compromised, then you might want to remove it. I don't like implants. I'm probably one of the few people in the world who doesn't like them. And they're called flippers. You can get a removable plastic tooth. Not ideal. But I personally, in my opinion, prefer them better than in implants, but everybody's different. So it just depends on your health. Kind of a broad answer, sorry.
Well, this is also where that cone beam would come in handy also, to make sure that you get a cone beam scan done to see if there's any cavitation, because sometimes you may not think that you're not healthy. You may think that you're healthy, but there's stuff happening underneath the scenes that you may not even be aware of. Dr. Lewis?
You know, putting in a root canal and taking out a root canal is an expensive proposition. And so I don't recommend everybody take it out either. I think the reason why they do implants is that it stimulates sustained bone growth, but you know, I wouldn't be a big fan of them either if there are other options. Another great option. But the thing is with root canals, and I completely agree with Dr. Perro, is that over time your immune system weakens and the opportunistic infection that can be harbored in that place gets worse. That's why you do blood testing, looking for elevated white blood cell counts. I've shown that you can tell if you have oral pathogens in circulation by looking at the Lyme line blot. It's not always going to be a perfect test, but if it lights up and you have root canals, there's a very good chance that's the source. And the other thing you can do fairly inexpensively is a swish and gargle test called the oral DNA. And that measures for 11 different types of pathogens, not what we call the usual suspects. There are way more than 11. And it also quantifies them. We call them the usual suspects. So usually if you see these up, it's indicative that there's an issue. And then, you know, then you have a guidance to look at the effect. Now I use a chlorine dioxide solution once a week, being sensitive to the fact that you have an oral microbiome. But the reason why we use chlorine dioxide is a gas can penetrate more deeply than a liquid or a solid. So you have a better chance of getting below the gum line. Then, of course, I like the water flosser. You know, it's like washing your deck with a pressure wash. It's going to get cleaner with some povidone iodine in there. My rule of thumb would be an ounce of 10% over-the-counter povidone iodine in your reservoir, and do that once or twice a week too. Once again, I don't want to bombard the oral cavity with all kinds of anti-infective oxidizing agents. I had someone tonight, you know, using mouthwash with peroxide. It's like
Double whammy.
every day. not what you want to do. You know, I learned this from nurses. I had nurses hire me. I said, what's your opinion on peroxide for a wound? They said, it's great to prevent the infection one time, but if you keep using it, it never heals.
Mm. Dr. Huante, is there a homeopathic approach to mold?
To mold, yeah, of course, there's things that there are remedies to detox, but I would also look some other things like bentonite clay, like turmeric, ginger, like sweating in a sauna, or here in Mexico we have temazcal. That's a little place, little cabin that you get in, and there you sweat. So sweating is also good for mold treatment.
Carla, any other questions?
Yes, I believe we have like 2 or 3 more. Okay, so this is from Ferd Berfel. Sorry if I mispronounced your name. Long COVID is now such a common affliction. What is long COVID? How can one treat long COVID? Thank you, Ferd.
Okay, we're going to kind of dance around that because we want to make sure we have this recording stay on YouTube. So just to, you know what I'm saying. Okay. Go for it, anyone.
You know, the best thing to do is go to the FLCCC and what McCullough recommends and things like that. They have extensive things. You know, we've run spike
I'll
protein
post it.
tests, and you know, I have people that say, oh, you do the IV glutathione, the vitamin C and all that, and it's bringing the spike antibody down 10%. Then they go someplace where there's a shedding and it goes back up again. You know, I think the best thing you can do is you're not necessarily going to have a treatment for the spike protein. We've seen some interesting results with methylene blue in not taken in liquid IV with strong visible light activation of it to create this reactive oxygen species. So, but then just to report on spirulina to save people from high mortality rates that are in hospital. So there's a bunch of natural things. There's so many different things. There's no real protocol, and I'm glad we don't want a standard of care. We still need doctors being creative at trying different things because we're in the infancy of this right now. But you know, I published on my blog, or maybe it's coming out tomorrow, that McCullough showed just another series of pretty good controlled trials on nattokinase. And so I don't think any of these things are miracles, and they're certainly not knocking the spike down. They're probably just protecting the vasculature. Because I haven't seen a lot of things that bring the spike down dramatically. There's a guy at the FLCCC, I'll close on this, by the name of Marsland, and he's probably done more spike antibody testing than anybody in the world and looked at different interventions. And I have a member of my team that follows him closely. I don't have an update on it because I'm not really interested in the stupid spike. I'm interested in you being healthy. And that's the number one thing that'll keep you from dying from the spike.
And I'd like to piggyback off of that, Dr. Lewis, that, you know, when I work with people in that situation, I look at it from a foundational perspective because I say to us, everyone is not succumbing to quote unquote long COVID. So the question becomes, what made you more susceptible? What were the weak links that need to be addressed to help the overall body to strengthen, to be able to rebound more effectively? And that requires a much more personalized conversation because everyone has different weak links. But we always have the foundations in terms of, you know, were you sleeping properly? Were you stressed out? Were you drinking properly? Were you eating good foods? Were you doing GMO foods? Were you doing all of these various exposures to in environmental toxins? All of these things need to be looked at and not simply look at the boogeyman being the spike protein, but rather you had a life before the shot or before COVID. What was it that made you more susceptible to the manifestation of quote unquote long COVID? Dr. Petto?
Yes, being strategic here and preserving our life on various platforms. Let me just say, not what I might have said, and I'll maybe I'll type that. But what I will say is that those with long COVID, I agree with Dr. Michelle, could have Lyme and co-infections. And when I say it could be Borrelia, it could be Babesia, it could be Bartonella, it could be EBV, it could be all of them, herpes, CMV, and they get activated because so many people are underdiagnosed with Lyme and co-infections. So that's one thing. I will also type the fact, I won't say it, but I just put this in the chat for those of you, just for sake of privacy. I do think that must be addressed. I don't look at anything now without a COVID sheen has tempered on how I look at people. I'm a microscopist. I do live blood analysis. So blood
Nice.
has changed and how live blood looks has changed. People have changed. I don't need live blood to know this, by the way. I usually talk to a person and people's health have deteriorated and look at some of the things that have happened in the past few years, and not just the spikopathy, but we know isolation and the other various factors, et cetera, et cetera. We don't need to go into all that. I know the time is running out. But so I would say I like a multi-pronged approach, and I bind up spike. I get rid of PEG, polyethylene glycol, and lipopolysaccharides. I try to diminish any additional adjuvants or surprises, and I'm going to type it in the chat just to be strategic here and be mindful. And any other aspects of that we need to address. So we address everything that someone may have been exposed to that might be creating long C.
Yeah. So
All I can say about the spike is Jim says, is shedding real? I don't have a lot of data on this, but I have a couple people that, so the LabCorp test 0.8 or below is not it's negative, okay? But people had a very clear correlation between people who had Omicron, Delta, it's going up. Omicron, they're kind of in double digits. Delta, they're in triple digits. And then depending on the number of jabs, they're over 10,000. I had people greater than 25,000. They're still alive and functioning like nothing ever happened. But I've had a few people that were in the hundreds, and they claim to have gone to different conventions, and there was a lot of people in close contact. This one gal, very health conscious. I mean, super, completely trust that she comports herself like someone in the functional world. And hers went from 225 over 4 months to 6,000. So, I mean, how reliable is the test? And I don't have enough data to say I see that all the time. But so I think shedding is real based on a couple example tests that I've run.
Dr. Huante?
Well, I think I'm grateful that there are no protocols to treat this, because in homeopathy, we see every patient like a particular person. So we see all the symptoms, the specific symptoms, and we treat them like that. We don't treat a syndrome, but we treat the person with the physical symptoms, the mental symptoms. So holistically, we treat the person.
And so I think we have one more question, Carla.
Yep, we do. This is from Evelyn Reed. She said, I would be grateful if you could answer this. My NL ratio, hopefully I'm saying this right, is too high. My LMYMHO, lymphocytes, sorry.
Lymphocytes, yeah,
Lymphocytes, thank you, are far
I
too low.
pre-read
Thank
it.
you, Dr. Lewis.
I pre-read the thing, yeah.
Thank you. What can I do to improve the ratio? Please, what can I take? What might be the reason? And are there any tests which might point to the reason why? And also just to add, docs, I copied and pasted. There was some of the people that asked questions. They also have additional questions. So what I'll do is I'll email you those questions.
Okay, and maybe we'll address them next month.
Yeah.
Okay, who wants to jump into the lymphocytes?
Well, I probably published more on neutrophil to lymphocyte than the average Joe, and neutrophils go up with bacteria, lymphocytes go down with viruses. Not always, okay? And I just wrote a whole article on lymphocytes, but when your NLR is bad, that's not a good thing. It's your infectious burden. And usually when the lymphocytes are low, it's viral, Epstein-Barr, HSV, cytomegalovirus. Got to treat that, and I talked at the very beginning about the ivermectin, hydroxychloroquine, Brownstein protocol, immunoglobulins. There's a number of different things you can do to treat viruses. But, you know, the best thing to do is get a viral panel run so we can see what organisms they are. So at least we have a gauge of how effective the treatment is. Because, you know, these treatments aren't perfect. And my own daughter had like super chronic fatigue. She'd go away for a week, come back home and stay in her bed for 3 days. And her EBV, IgG, which most doctors would say was historic, it had mono go away, came down dramatically on treatment, and her energy went the exact opposite direction. So these antibodies that are presumed to be just a indication of past infection are absolutely not. These things can morph into very stealth phases. The best work done on this is Dr. Charles Stratton out of Vanderbilt that looked at chlamydia pneumoniae and characterized at least 3 different phases of that organism. And in one phase, it's refractory to antibiotics and refractory to the immune system. This organism can travel to the brain inside a neutrophil. The white blood cell should be killing it. Okay, so we're fighting the Taliban here internally. So it's tricky, sneaky business. So, but you can test for them and you can treat and show that they go down. And usually if the patient feels a lot better, that's the ultimate thing we're trying to achieve anyway.
Dr. Petro?
I would totally agree with that. And you might want to do a stool microbiome test and see what your microbiome is doing. Because bifidobacteria, one of the key organisms that produce short chain fatty acids, as well as assist with T cell function, might help. The other thing you might want to consider, so increasing your beneficial bacteria, make sure they're not so low. And if you don't want to do the microbiome test, just take a probiotic. In addition to eating fermented foods, just take a probiotic that has increased bifido strains, bifidobacteria, and lactobacilli strains, at least like bifidobacteria brevis, infantis, lactis, lactobacillus, rhamnosus, reuteri, lactobacillus acidophilus. So you want at least 5 to 25 billion colonies of bifido and lactobacilli if you're not going to get it checked, because you have to work with somebody, it costs money. But additionally, there is a homeopathic that I like. It's called thymulene 9C. I'll write in the chat. And it stimulates the thymus. And the thymus, as you know, is an organ that most adults have. It's been regressed. It's an organ that sits behind the sternum. Babies have a very robust thymus. And that creates something called innate immunity. So when I hear lymphocytes are low, I just try, sometimes I give some thymulene 9C. I might give 1 dose daily and see if I can boost up their lymphocyte counts with some of these other measures as we search for the root cause and figure out why your lymphocytes are so low.
I love that answer. That really added to my repertoire. Thank you.
Dr. Michelle, this one might be really
Dr.
good.
Huante?
Oh, sorry.
Wait a minute. Dr. Huante?
Well, additional to what Dr. Michelle said, also, and the energetic medicine, you can stimulate your thymus by tapping it. So tapping it a couple of minutes or 5 minutes a day, it's an easier way to stimulate your thymus and your lymphocyte count.
Amazing.
Awesome. So you had one more, Carla?
Oh my gosh, there's so many great questions. But I know it's the rainy season, so I'm trying to ask this one, Frank Solga, and he says that so many homes have been affected by flooding of the basements and first floor. How can these homes ever be mold-free?
Well, I can jump in there because I have a lot of friends who live in moldy houses that have been flooded. I have a lot of friends from New Orleans. You can get a dehumidifier and put it in your basement. Once you might have to do mold remediation. You might, and I know people have had to lift their houses. How crazy is that after you own your house? We're talking about lots of money and creating flow underneath the house. In some like wet areas, they live up on stilts, like they elevate their houses. But in the meantime, you can get a dehumidifier, and it'll take the humidity. You got to take every wealthy home should get a dehumidifier and a HEPA filter. So, and you certainly don't want to sleep in that moldy area. It's difficult, Frank, to remediate it when you're in a flood zone. It's not easy.
What are your thoughts on using an ozonator?
Ozonators can kill mold. That is true. We use them in swimming pools. We use them in hot tubs. I just wonder, I have a little personal ozonator. I'm going to show it to you. I used to put in the clinic during COVID, seeing patients. It produces a little ozone. I would breathe it right in. I plug it into my computer. Just so you know, I travel with it also on the airplane. I'm like giving myself ozone. I'd say it's a good thought, but I don't have any data. I like it though. I like the idea.
I have one that's about a foot square, and what I do is when I'm in the humid season, I'll just put it in the basement from room to room and let it just run.
Yeah.
And
I do the
but the
same thing here in
dehumidifier is
Florida.
number one. You got to put the two. You have to do the two together, and then you get your paint to. You got to coat over that stuff because you'll never get it out. So you paint stuff and try to put barrier as much as you can.
Another thing that you may want to consider is using essential oils like tea tree and oregano and things to diffuse those in the room, as well as the dehumidifier and the ozonator. But mold can be a bugaboo. So it's like a never-ending battle if you have one of those situations, unless you do like Dr. Petro says and lift your house up on stilts or something.
Yeah.
But
We'll all come down and help you out.
Well, in any case, ladies and gents, thank you so very, very much. I want to say special thank you to all our wonderful doctors, Dr. Lewis, Dr. Pero, Dr. Huante. It has been phenomenal, and we look forward to being able to serve you next month. Same bat channel, same bat time on the third Thursday of the month. Until then, peace and blessings.
Thank you.
Bye-bye.
Bye-bye.
Bye.